Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
Welcome, everyone. I'm Emily Brown. I'm the Program Director at Cancer Support Community Atlanta. Thank you for joining us today for this program specific to our caregivers, navigating the challenges of caring for a loved one with cancer. Again, we wanted to do this program specific to caregivers since it is National Family Caregiver Month, the month of November. And we feel like caregivers are often the forgotten piece of the cancer journey. And it's hard to take care of yourself while also caring for another person. So we wanted to do this program specific to you. And I will go ahead and hand it over to my co-presenter, Michael Rodriguez.
Good morning, everybody. Good morning, caregivers. My name is Michael Rodriguez. I'm a licensed clinical social worker. I work for Georgia Cancer Specialist, which is affiliated with Northside Hospital. Georgia Cancer Specialist is an outpatient oncology cancer center. I've been there 19 years, and so I've done a lot of work with caregivers over my time. So I'm delighted to be here to help conduct this presentation. As Emily said, National Caregivers Month. We want to take the opportunity to, acknowledge the critical piece that you play in the overall care and support of somebody going through cancer. Often your contributions are overlooked. It's not always visible, the care that you're providing behind the scenes at home. So if you're new to caregiving, hopefully the information you'll hear today will be informative. If you're in the midst of caregiving, hopefully, you'll gain some further just insight in what you're experiencing. We hope that you'll take away some tips and some suggestions, some tools and some resources just to help you as you go back home and navigating your way on the road to caregiving. So we'll start off. So again, as I said, your contribution is often overlooked. And so that's why this is, the unsung heroes, right? You perform such a critical, vital role, in the overall care of the person, and have a huge impact on how the patient, deals with their cancer and really copes with the diagnosis and the treatment process. So who is a caregiver, right? I mean, what defines a caregiver? Well, caregiver really is anybody that's, available, that's, willing to take part and attend to the physical and emotional well-being of the person with cancer. Typically, you're not being paid to do that. There are places where you can actually hire a caregiver to come in and help out with, say, the day-to-day activities, but that person typically has some experience or training, some nurse's aid training, which most of you all, I suspect, do not have, right? We know that cancer happens unexpectedly. It's not something that you're prepared for, right? So there's not certainly a guide. You haven't taken a course in it. You're not trained or prepared to encounter a lot of things that you may encounter once somebody's diagnosed with cancer. So a caregiver could be most commonly a spouse, a partner, husband or wife. It could be a child taking care of a parent taking care of a child. It could be any other extended family member. Often in the absence of family, it could be you could be a neighbor, a coworker, a friend. Perhaps you are didn't volunteer to be a caregiver, right? Again, due to somebody else being available to do so, you're sort of reluctantly thrust into this role. Is safe and that their needs are being met. So, what are some of the roles and responsibilities of a caregiver? What are some of the tasks? Well, they could really vary depending on the type of cancer the patient has, the condition, how they're responding to treatment, and that certainly could vary and change over time. It could be providing a lot of physical support. So again, if the person is having a difficult time, with their treatment, if they're very fatigued, weak, having a lot of pain, you may be more involved in some of the day-to-day activities like, helping them bathe, helping them dress, helping them get from one room to the next, in and out of the car. And that could be very challenging. Say the person is 250 pounds and you're 110 pounds and you're having to, again, day to day kind of take care of their physical needs, again, that could be very difficult to do. It could be offering a lot of practical support. You're all of a sudden becoming the financial advisor, the legal advisor, the bookkeeper, having to take on the responsibility of being sure bills are being paid, managing the finances. There could be a loss of income, so just trying to figure that part out. Maybe that's not something that you're accustomed to or used to. Maybe the other person was always responsible for doing that, and so now that's your responsibility on top of everything else that you have to do. Certainly providing transportation, getting the person back and forth. We know when somebody's first diagnosed with cancer, there's multiple appointments, appointments for scans, to get port place. Sometimes it does require a driver. So again, that piece is crucial, as well as just providing emotional support. Being sure that the patient is being supported and encouraged, and that their emotional needs are being met. But just important that you take care of your own emotional needs, which is what we're going to get to next. So just some quick statistics that kind of highlight the amount of caregiving that occurs in the US alone. Almost 40 million people are caregivers of an adult with a disability or illness, and 2.8 million provide care to a person with cancer. Cancer caregivers tend to be women at 58%, but not always. Of course, we encounter male caregivers, and hopefully there are some on the call with us today. Average age of a cancer caregiver is 53 years old, 4 years older than non-cancer caregivers. So in that age group, certainly as well, if you're a younger caregiver, you also have maybe your own responsibilities with your job, your employment. You're raising children as well, or maybe you're already taking care of, say, elderly parents, and now you're also tasked with caregiving someone in the household who has cancer. So again, that could become very overwhelming. Next slide. So here we want to really focus on, some of the emotional stress that comes with caregiving. And so certainly to preface that, caregiving can be a very rewarding experience, right? It gives one a great sense of satisfaction, accomplishment, contribution. You take a lot of pride and joy in being able to take care of somebody when they're being diagnosed with cancer, somebody that's close to, just feeling like you're needed. So again, there are a lot of positives and rewards, that can be, taken away from caregiving. And we certainly, want to emphasize that as well. On the flip side, though, as I acknowledge, there's a lot of stress that can come with caregiving. And so, we want to certainly highlight what some things you might be, or some feelings you might be experiencing that are okay, right? There's normal worries and concerns when a loved one is diagnosed with cancer. It's normal to feel sad. It's normal to be worried and concerned about the future, just the uncertainty of the future, changes in lifestyle, financial worries and concerns. These things occur when someone is diagnosed with cancer. And so, you as a caregiver are impacted just as much as a patient in a different way, but it's important to take some time to reflect on your own emotional response to a diagnosis, and have some time to process that, because if not, it could lead in long term to greater emotional coping difficulties. In our practice, we talk about distress a lot. It's something that we actually screen for. We screen for distress amongst our patients and our caregivers, and it helps us just to identify what are going to be some of the needs and concerns that people have, and some of the services and support that we can provide. And so distress is defined, and this comes from the National Comprehensive Cancer Network. Distress is a multifactorial, unpleasant emotional experience of a psychological, social, and/or spiritual nature that may interfere in one's ability to cope with a cancer diagnosis, symptoms, and treatment. And so as caregivers, you experience distress just as the person that's diagnosed with cancer does. And so some of the things that may occur beyond that, some of the things that you might be feeling at some point in time, and it's important to be able to identify what those feelings are and to label them appropriately. Then you kind of know where to get help and how to get help. Depression occurs. It's common. It does happen amongst patients and caregivers. Depression goes beyond it's excessive sadness that lasts more than at least 2 weeks. It could include, feelings or a sense of hopelessness and helplessness about the situation. You're having, crying spells. Just irritability, short-tempered, oftentimes a sign that person might be feeling depressed, just feeling blue, down and out, discouraged. Anxiety goes beyond just normal worries and concerns. It creates a lot of intense negative thinking, fear, if you're ruminating on things, circular thinking, difficulty sleeping, you're just really restless and agitated, certainly a sign, a symptom of anxiety. There may be anger. You may be angry that this is happening to your loved one, to your family. Anger often comes when it's hard to show. Fear, you're afraid. A loss of control can be reflected in anger. Anger is also a sign of depression. So, anger does occur. There could be guilt. It could be guilt that you're the healthy one, right? Survivor's guilt. As a caregiver, there may be guilt at times that you're not doing enough, or guilt that you want to take some extra time for yourself, right? So guilt occurs. Loneliness occurs, when you're a caregiver, and again, depending on how much you're needed by the person, times caregiving can become a 24-hour job. And so it kind of pulls you away from, your normal routines. And so there's increased isolation that occurs. You don't have enough time to spend with your friends or get together with folks, and do things that you would normally do because you have to be there, to take care of the person with cancer. So it can be lonely at times. And just overall, just the uncertainty and the unknown that comes when you're diagnosed with cancer, just not really knowing exactly what might happen next, and just worried and concerned about the future. So, slide. So once you've been able to, take some time and identify, what you're feeling, and how you're really coping with it. The next step is to figure out, how do you really cope with those emotions? So it's important to certainly accept your feelings for what they are. Try not to deny them. Again, taking some time to see again how you are responding to this and what impact this is having. Try to understand why you're feeling the way that you're feeling. And it's okay to let go of mistakes. This might be new to you. Again, you're not prepared. There'll be times when you make mistakes, but it's okay. It's important to remind yourself that you're only human. Caregiving wasn't created out of a comic book. You're not a superhero. You're not, Superman or Wonder Woman. And so there'll be times, when you might make mistakes. I was just yesterday on the phone with a daughter who's taking care of her mother, and she was expressing a lot of stress and frustration. Her mother, won't get out of bed or can't get out of bed, either due to some physical concerns or the patient's depressed, and she won't really follow up with her care and get back into the office to be reevaluated. And the daughter was feeling like she was a failure, that she was letting her mother down. And so part of it is reassuring her that it's okay. You're doing the best that you can. You're doing the best that you can, and to take some pressure and stress off yourself, and knowing that you're doing the best that you can, and that if you feel like you're not doing enough, that you've reached out to us so we can further try to get in there and see what's going on, just to help you out at home, with your loved ones. So know what your strengths are. Know what are you good at. What are some things that you're good at. Maybe you're kind of good at the day-to-day, taking care of the person, being sure that you can get, they can get showered and they can get food on the table. So know what your strengths are, but also know what your limitations are. Set some realistic sort of expectations for yourself on really what you're able to accomplish and what you're able to do. That includes maybe sort of readjusting your priorities. Focusing your energy on the things that you can control. And know when to ask for help. I mean, it's okay to ask for help. Don't feel like you have to do this, all on your own. Think about who amongst the support system is also available. People want to help. And I get it that sometimes there are instances where there really isn't anybody. And, there have been times when we talk about asking for help and there truly isn't anybody available. But if you can kind of really think maybe just beyond your family, who else in the community, either through church, neighbors, again, anybody, people want to help. They want to feel like they can take part and they can also contribute. It helps to be specific about what people can do when you ask for help. Maybe it's run to the store, grab a prescription, grab some groceries, or you come over, spend some time, with the patient while you get out and you go to the store, you run some errands, just to come and spend some time with the person so you can maybe get some things accomplished around the house. So really important to try to, ask for help to, again, not feel like you're shouldering all the load, and you most importantly have time to take care of yourself. And Emily will talk about self-care. When you're diagnosed with cancer, it certainly causes one to look at life in a different way. And so a cancer diagnosis can be viewed negatively and positively at the same time. And so, finding meaning, why is this happening? That's a question that may get asked, why is this happening to me? Why is this happening to us? This is really where your spirituality, your faith, your belief system can really kind of help you come to a place of acceptance in terms of what's happening. It's certainly a source of strength and comfort for peace for a lot of people. So certainly trying to find some meaning might help you as you deal with what you're experiencing. And most importantly, if you continue to have a difficult time just dealing and coping with everything, seek professional help, call your doctor, seek out a counselor. I'm a social worker. Part of my role is to provide, some supportive counseling, to the person diagnosed with cancer, as well as caregivers and family members. So, wherever wherever the person is getting to treatment, ask what resources are available to help, in terms of counseling for you, and also reaching out to, a support group. Emily, cancer support community has support groups. And so connecting with other people to kind of reduce that isolation, to be able to connect with other folks who are also going through this as well. Just to have that commonality and to know that, you're not alone and other people are experiencing just what you're experiencing.
All right, so I'm going to talk a little bit about some self-care tools that you can use, keeping it in your self-care toolbox, because like Michael said, that's going to be really important through this whole process. You cannot take care of somebody if you are not first taking care of yourself. So I wanted to include this quote in here. You are still not allowed to have a life of your own when you are caring for someone with cancer. So I think that's something that people often forget or maybe even feel guilty about, carrying on with their normal activities when someone that they care about greatly has been diagnosed with cancer. But it is very important and essential for you to continue on and do those things that you enjoy while also caring for someone with cancer. So it is also important for you to know when to set limits. You need to think of your energy as a limited resource. And when you are expelling so much energy caring for someone else, you need to make sure that you are saving the energy for yourself as well. You need to pace yourself, control stress, and make self-care a priority. And I'm going to go over some ways in which you can make self-care a priority. But controlling your stress, if you have a lot of outside obligations or responsibilities, maybe kind of delegating those or thinking about other people and ways that they can help you so that you can control your outside stress and focus on the matter at hand and caregiving for your loved one. So here are some examples of ways that you can practice self-care. And I'd love to see if you want to put in the chat different ways that you found to care for yourself, activities that you enjoy to practice self-care. But just a couple examples: going outside for a walk. Maybe you have a pet, maybe you walk with a friend. Really just the changing of an environment when you're in a stressful situation or you've been caring for someone all day and you need to just step away. Going for a walk can be a wonderful way, not only just to get exercise, but also just to change your surroundings, your environment can help change your mood and regulate yourself as well. Practicing meditation or maybe yoga is a great form of self-care. Spending time with other friends or loved ones, laughing. You'd be surprised at how much time we spend laughing in our support groups. It might seem counterintuitive due to the what we're talking about in support groups, but we actually really do find a lot of time for laughter, and it's important. Enjoying an activity, maybe taking up a new activity. If you enjoy listening to music, or maybe you enjoy playing music, just different hobbies like that can be great forms of self-care. And also just a mindful practice thing to do. If you're playing an instrument, it can be a mindful activity, staying present in the moment. Getting exercise, There's a lot of different forms of exercise you can take. I know pickleball is really popular right now. That's a great form of self-care, getting outside, getting some exercise. And then just finding quiet time for yourself, maybe reading a book, just going out to a local coffee shop, just doing something quietly, some sort of mindful activity that can help with self-care. So did anybody have any examples of how they practice self-care? I think when we presented this at the patient symposium, somebody said cooking was their self-care, which is a great form of self-care, something that you enjoy doing that can be creative and also a mindful activity. Somebody in the chat. Pilates. Yes, that can be wonderful exercise, stress reduction, stretching. Thank you. That's a great example of self-care. Anyone else have an example? All right, we will move forward. I just wanted to put in a list of all the weekly classes that we offer here at CSC Atlanta. And we offer these programs free of charge to anybody who's been diagnosed with cancer, as well as their caregivers. So just here's the list to the left there of all the classes that we're currently offering. And we offer classes both in person and virtually. So if you're not able to come into our center, which is located next to Northside Hospital Atlanta, you're welcome to join virtually. And we also have pre-recorded classes that you can attend to just help you take care of yourself while also taking care of your loved one. And you can register for those classes on our website at cscatlanta.org. Somebody said planting. That's a great self-care exercise. Yeah, absolutely. Getting outside, enjoying nature. Thank you for sharing that. I think this is you, Michael.
Okay, so yeah, so we'll talk about communication now, which communication is really one of the most, if not the most important aspects of caregiving. A lot of conversations can take place during the course of the diagnosis and throughout the next phases on through treatment. But we know that people communicate in different ways, right? People have different communication styles. You may be one that's very, open, expressive, and wanting to verbalize your thoughts and feelings a lot, while the other person may be more to themselves, quiet, keeping things to themselves. So it's really important, to respect how people do communicate differently. But if you can, you certainly want to establish, from the get-go, a goal of openness and sharing and honesty, from the start. Certainly reassuring that person, that you're there for them, that they're your main priority. Certainly some examples of things that you can say, that this is a scary time, for both of us, but I'm here for you. I'm here for you whenever you're ready to talk, that you're not alone. Remind the person that you're a team, that you're in this together, right? And that you'll get through this together. When you're diagnosed with cancer, certainly conversations that take place are of a very difficult and sensitive subject matter. Think about the things that, we think about when we're diagnosed, with cancer, our own mortality, thoughts of dying, sickness, illness. And so, it's hard to have those conversations. And so just some ways to approach, having a conversation, asking permission, is it okay that we kind of, we sit down, find a quiet time where you can have that conversation where you're not being distracted. You might want to be prepared, so practice, what you want to say, be clear about, what your aim is and really what is the goal of the conversation. What are some things that conclusions that you want to come to at the end of the conversation, be it making, treatment decisions, and not feeling like the need that you need to resolve everything at once, because then we're diagnosed with cancer. I mean, things happen. It's a process, right? There's the diagnosis that has to be discussed, and then it's, the diagnostic phase, and then it's deciding on treatment and then getting through treatment. And so, again, conversations may have to take place more than once. So not really feeling like the need to resolve everything at once, but remaining open to having those conversations along the way. Avoid saying that everything is going to be fine. People have a tendency to say that, it's going to be okay, it'll be fine, don't worry. We have a tendency to say that when it's something that we're not comfortable with or something is scary, but you want the person to know that you're going to be there for them, that you want them to be open, you want them to be vulnerable, and that you're there whenever they're ready to kind of talk. You really want to be able to know what they're thinking and what they're feeling. So, trying to avoid saying everything is going to be fine. Sometimes the best thing to do is just listen, to just be silent, to just be, a presence. You're not there to judge or change the way that the person is feeling. You just want to be there to simply listen and hear them out and let them know that that's okay. As a primary caregiver, you may also be responsible for communicating with other family members, right? You're probably getting calls from other folks saying what's going on, what's happening. And so a good way to handle that is to set some family meetings, try to get everybody together if everybody's, say, locally, or if not, set a time to get everybody on a call, on a Zoom call, where you can, take that time to get the latest updates on what the doctor said, share, reports and findings, take that opportunity where everybody can kind of give their input, can talk about how they're feeling, take that time to see how other folks can contribute, how they can be involved with the person, how they can also help you as a caregiver, come and spend more time with the person so you can take care of some things for yourself. So, certainly, communicating with other family members may be a part of, your role as a primary caregiver. Next slide. And so it's not just communicating with the loved one or with a person, but with the healthcare team, right? You're really viewed as a link between, the person and the healthcare team. And oftentimes you are the voice for the patient, depending on, again, the type of cancer they have, the kind of condition they're in. Oftentimes, you really might have to take the lead in communicating with the healthcare team, what's really kind of going on. And so, generally, we can share information with you. Oftentimes, we go into patient rooms and you're there with the patient. So the doctor is obviously having that communication in front of you, but you want to be sure that, you're listed on any front office forms as somebody that we can discuss the patient's care with. There's HIPAA related privacy. Obviously, confidentiality is crucial. And so, again, you want to be sure that you are, listed as somebody that we're able to discuss the patient's care with. And so that allows us to simply discuss the care with you. It doesn't allow you to make healthcare decisions for the person. And so that's where an advance directive comes into play. A Georgia Advance Directive for Healthcare, allows you to make healthcare decisions in the event the patient is unable to speak and verbalize, their wishes or desires about their care, with the hospital and with the doctors. And so what it is this, allowing you to be their power of attorney, their healthcare agent. And so, again, it allows you to, make decisions about life-sustaining measures, medications, procedures, if it's come to that. So certainly that's important to consider completing one of those if you haven't. I think it's always good, regardless of any situation, to have that in place to protect one's wishes about their care and how they want it to be directed. It simply needs 2 witnesses to sign it. There are some conditions of who the witnesses can be. It actually does not need to be notarized. And you can find an advance directive anywhere. I mean, we keep them in our practice. So the next time you're in, if you haven't completed one, ask somebody for an advance directive. You can also find them online anywhere. If you just Google Georgia Advance Directive for Healthcare. And so, really, again, learning to communicate with the healthcare team, it can be an overwhelming task. Just, again, trying to understand a lot of the terms, a lot of the lingo that comes along with, cancer diagnosis, the terms that you're not really familiar with. So, that can get to be, frustrating as well. You really at times can take on an advocacy role, right? You're also looked at as an advocate. So when you become the voice of the patient, you're advocating for their needs. And so just thinking about what will help you, in that sense, before the doctor's visit, it's important to just be as prepared and as organized as possible. Staying very organized, keeping a folder, in our offices, any patient that's going to get treatment gets this big binder. And in the binder, there's tabs where we have some of our resource information about different services, but there's also a notepad and a pen, a place to keep business cards. And so you can write down, notes, just a way to kind of keep track. You want to know the names of any other doctors the patient has seen, dates of any tests and procedures that the patient has had, any pertinent medical records, obviously keeping a name of all the medications the person is taking, quite often we go in the room and we ask, well, what are you taking? Who's prescribing it? And people don't know. I mean, that's pretty common. And so, it's important that we know what medications, who prescribing them, the dosage of those, so we're not prescribing something that could potentially have a drug interaction. So definitely keeping a list of medications and bringing that with you. Reviewing with the patient, what you want to discuss, what you hope to learn from the visit. Again, what are the goals? Keeping a list of your questions. Anytime you're at home, anytime you think of something, write it down. So when you come in, we know that on average, you may have anywhere from just 10 to 15 minutes to spend with the doctor. Doctors' offices are very busy. There's wait times. So you might not always have, a lot of time to spend. So you really need to make the most of that time and really take advantage. So be prepared, have a list of your questions. When you're at the doctor's office too, find out who are the other folks that are going to be involved in taking care of the patient. So the nurse, in our practice, there's always a hall nurse that works with the doctor who's responsible for, say, putting in orders and those kinds of things. But in the treatment room, there's a different set of nurses. And so you want to familiarize yourself with important people, because these people are also valuable sources of information. Your front office people, your lab people, social workers, just getting familiar with all the different people in the practice and what role they play and how they can help you. When you're with the doctor, take notes, ask if you can actually record the visit. It's hard to keep up with writing a lot of things down. So ask if it's okay so you can record the visit. So afterwards you can get home, you can replay, what the doctor discussed. And so when you're with the doctor, certainly some things that you want to ask or to consider, when you're there, who do we call if we have a problem or a concern? What's the best way to reach someone, by phone or by email? With our practice, we have a patient portal where you can email, and I believe the nurse answers and responds to any email questions. So that might be the most effective way to communicate with the practice. If you do call, we have an on-call. Sometimes you leave a message with the nurse's line. And so, how long should you wait for someone to return your call before you try calling again? If the doctor or nurse is out of the office, who should you call instead? And what constitutes an emergency? What's a reason to call, and what's a reason to say take the person to the hospital? Oftentimes we get calls when we're just going to direct that person to the hospital. So maybe even talking beforehand, what's a reason that we will call, and what's a reason that we might want to take the person, to the hospital, to the emergency room if it's necessary. But also remember that, with our practice, there's always somebody on call after hours, and on the weekends, you don't have to wait till Monday. So just knowing, what are the practice hours, and what are some of the procedures in the event something else occurs. And so after the doctor's visit, setting a time with the patient to review and process the information that you heard. You really want to be on the same page, that you both have the same understanding of what's happening and what's occurring. What are the goals and what are the expectations of treatment? What did you hear? What did you understand? This is really where you want to kind of keep those lines of communication open so that you can effectively make those healthcare decisions together.
All right. And we had someone say in the chat, I think it was Gwen, that she always has patients make sure they're updating their phone information, because that can be a way that doctor's offices are trying to communicate with you. I know a lot of doctor's offices will send texts about appointments. So you definitely want to make sure that your contact information has been updated. Thank you for pointing that out. Somebody asked what practice you're with, Michael.
I'm with Georgia Cancer Specialists. We are part of Northside Hospital, but the practice name is Georgia Cancer Specialists.
All right, now we're going to go into a resource toolbox, just different resources that are available to you as a caregiver, and that you might want to check out if you haven't already. So here are some resources for financial assistance. There is Cancer Care, which is a national nonprofit that provides financial assistance for transportation, home care, and child care, as well as co-pays. They also have a national phone line that provides different counseling options. If you're interested in that, that's cancercare.org. The Cancer Legal Resource Center is a national program that provides free and confidential information on cancer-related legal issues for patients and caregivers. Sometimes caregivers can face discrimination from their employers about trying to take time off for the Family Medical and Leave Act. So that's a great resource if you feel like you've been discriminated against. It also provides information through a national telephone assistance line to educate and support cancer patients and their families, and advocates on matters like maintaining employment through treatment, accessing healthcare and government benefits, as well as taking medical leave. Then there's the Atlanta Legal Aid Foundation. They have their health law unit that can assist cancer patients with a variety of legal issues, including housing, public benefits, employment issues, health insurance access, and end-of-life estate planning. The health insurance marketplace for anyone who doesn't have insurance coverage, Medicare or Medicaid, or another source the marketplace can help you find and enroll in a plan. Patient Advocate Foundation helps patients access care through financial aid and other resources. There's the United Way, which provides information on local charities, as well as any kind of disease-specific foundation that might be available to you. Transportation assistance is something that we often see as being an issue, especially if the patient's getting something like radiation, regular chemo treatments where they have to go back and forth multiple times. The American Cancer Society has their Road to Recovery program, which is volunteer drivers who will drive patients to and from appointments. I will note that they do require advance notice for appointments, and they are limited to the service area in which they have volunteers available. But you can call, go on the ACS website and find the phone number to call and schedule a volunteer driver. There's also assistance if you are required to fly somewhere to get treatment. The Miracle Flights and Air Charity Network provide air travel assistance, as well as local organizations, maybe within your county. It has a 60+ program, older adult program, transportation assistance. I know Gwinnett County specifically has one. So that's just another local resource to look into if you're in need of assistance with transportation. Other resources that can be really helpful for caregivers include Cancer and Careers. This is a wonderful organization that does different education programs on how to work through cancer treatment or returning to work after cancer. Also supporting caregivers who are working while supporting someone with cancer. Triage Cancer provides free educational resources and legal and practical issues that arise after a cancer diagnosis of a loved one. And then CSC Atlanta also has our own video library of resources, different education programs. We've done programs on genetics and cancer, disease-specific education programs, financial assistance programs. So you can find all the videos. We have over 100 videos on our website, all related to cancer and cancer treatment at www.cscatlanta.org/videos. And this is just a slide on knowing your options and rights through these organizations that exist to support people with cancer as well as their loved ones. The American with Disabilities Act, some people with cancer can be considered disabled and receive reasonable accommodations to perform essential job options. So if you think that your loved one might be a candidate for that, you can check out ada.gov to learn more information about that. The Family Medical Leave Act, often called FMLA, allows an ill person or family member caring for them to take up to 12 weeks off from work without pay, but with no loss of your benefits. And time off can be taken a little bit at a time or all at once. So you can talk to your human resource department about your specific situation if you're interested in that. And also Social Security disability. Like I said before, some cancer diagnoses can actually qualify you to be disabled and allow you to get some benefits through that. So if your loved one's no longer able to work, he or she may be eligible to apply for SSDI. And these are all resources that you can talk to your oncology social worker about. If you're going to a medical oncology practice, you should have access to an oncology social worker, and they are wonderful resources for all kinds of information regarding caring for someone with cancer, and as well as just financial assistance opportunities.
Well, lastly, we wanted to share this caregiver bill of rights that I found. It's this is adapted from the book Caregiving: Helping an Aged Loved One by Joe Home, and I certainly think it applies when you're caregiving for somebody with cancer. And so I like this. I think it just really, validates a lot of what we've talked about today, but certainly what you might be feeling and experiencing. And so just want to recite just a few of these, that as a caregiver, I have the right to take care of myself. It's not an act of selfishness to take care of myself, that I have the right to seek help from others, that I recognize the limits of my own endurance and strength, that I have the right to get angry, to be depressed. As we said earlier, just having some of those other difficult feelings occasionally, that you have the right to feel that way, that I have the right to receive consideration, affection, forgiveness, and acceptance from my loved one for what I do, for as long as I offer those qualities in return. That I have the right to take pride in what I am accomplishing, and to certainly applaud yourself for the efforts that you're making. That I have the right to take pride in my individuality, and have a right to make a life for myself that will sustain myself in time. And that I have the right to expect and demand that as new strides are made in finding resources to aid in the person that you're taking care of, that similar strides will be made towards aiding and supporting caregivers. So I really like this. I don't know if folks will get a copy of the presentation or have some way to access this, but certainly if we can find a way to share this, might be good to just kind of print this out, post this somewhere, just as a reminder that you too as a caregiver have a right to take care of yourself, and that you're doing the best that you can. So I think that sort of ends the presentation part. So certainly, this is the support group. Do you want to talk about this? Oh.
Yes, this is just information about our Family and Friends virtual support group that meets twice a month on the second and fourth Monday. We meet in the afternoon to try to allow caregivers who are still working to come, and this group meets in person and virtually. So if you are interested, but you're not able to come into our office, you can join virtually, and you can register again at cscatlanta.org. But first, contact me, and here's my contact information, and I can give you more information about the group if you're interested. Now I think we just want to open up for any questions anyone might have. If you're experiencing a certain situation, or if you're just looking to connect with other caregivers, we want to do that, allow the opportunity to do that.
Yeah, so certainly would like to hear from many folks, what are some of the challenges that you might be dealing with currently, in your caregiving experience, what are some difficulties that you're encountering, or perhaps you may want to share, some things that you have found helpful, if you've already been doing caregiver, maybe there's some newer folks here, you guys are the experts. We kind of talked about that as well, again, you guys are in the trenches, doing this day in and day out. And so certainly would like to hear what you have found helpful. Maybe there's some advice that you would like to share with others, some things that maybe we didn't really discuss today.
We have something in the chat. I think keeping great written records is really helpful. Yes, absolutely. Writing things down when you go to the doctor's appointment, just to kind of jog your memory of what all was discussed, because it can be a lot of information sometimes, is a great tool, as well as I think Michael mentioned, recording the visits if the doctor is okay with that, can be a great tool to use. We had a pre-submitted question that I'll just throw out if anybody can relate to this. I hate feeling like I'm the only one who cares about the cancer. How can I motivate my spouse to take ownership? Is anybody able to relate to that, where they feel like maybe their spouse is less motivated, or they're just not on the same page about the cancer treatment? Say from a social work perspective, autonomy is always important, and you want to be respectful of a patient's decisions, and allow them to have a sense of control with their treatment. Although you might have the personality to want to take over and take control, it is important to be respectful of what those patients' wishes are, and help them feel like they are communicating with you on their wishes.
Yeah, absolutely. You want folks to feel like, especially when there's such a loss of control, that they are fastest that they can, still maintain control and make decisions, a sense of independence. I'd say if you're concerned about a lack of motivation, explore what they're feeling. Could be a sign of depression. And so, there may be some of the things kind of going on that you may want to address to help get the patient maybe more motivated and willing to participate in their care.
Somebody said in the chat, I've noticed that patients with cognitive impairments have difficulty accepting another person as their temporary caregiver, leaving the caregiver feeling stuck. Yes, that can be especially challenging. Difficulty defined as open hostility and aggression for somebody who's been assigned a caregiver. Well, if there aren't any other thoughts or questions, I think we can wrap for today. Michael, thank you so much for taking time out of your day to do this presentation for us. And we did record it. If you want to look back on maybe those patient or caregiver bill of rights, we will have this posted on our website, cscatlanta.org. And again, if you're interested in joining our caregiver support group or any of our other programs for stress reduction, education, cscatlanta.org, and you can contact me, Emily Brown, and I'm the program director there.
Thank you.
All right. Thank you so much, everyone. I hope you have a wonderful rest of your Wednesday.
Good luck.
And happy Thanksgiving.
Happy Thanksgiving.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.